I thank the panel for this interesting discussion. For the next session, which is the visions from our funding partners, I will now request Professor Shinjini Bhatnagar to coordinate.
I think this is one of the sessions many people would look forward to, because at the end of the day, the funders are the people who actually facilitate your research. And what can be better if the funders really understand what you want to do? So in keeping with that, I'm going to introduce Dr. Anamika Gambhir, who's here with her colleague Neha. And Anamika is a PhD, and after that she joined Department of Biotechnology. She's been there for 21 years. She deals with many programs, but for us, she's been the biggest support for the program on maternal child health and Garbhini. Before I ask Anamika to come here, I just want to say and thank DBT for the support we've got from them through her, largely because I think they feel for the program as much as we feel. And that's a very important point, that the funder realizes that this program is important. So with that, Anamika, we promise not more. She said, I'm not going to speak for more than 5 minutes. I said, we won't ask you to speak for more than 5 minutes.
So I think I will not speak for more than 5 minutes because it'll get very boring for you all, especially because it's not anything technical that I'm going to be speaking about. And the most important reason is that I have a defective voice box. It won't allow me to go beyond 5 to 7 minutes. So just very briefly, how maternal and child health program came into being for Department of Biotechnology, because biotechnology per se is not the department where such a division should have been there. It is a health ministry's domain, but then in 2011, with the visionary leader in Dr. Bhan that we had, he said that, we need a separate division which can really look into the deep fundamental knowledge and mechanistic paradigms of pregnancy and fetal growth. So let's start this new division, with the name of maternal and child health. And ever since, the program has expanded significantly. Now it is like we have been funding the far off universities, colleges across the country. So there are different domains that funding happens in the maternal and child health domain. And primarily here, as I speak, it's about Garbhini, and how Garbhini came into being. So when funders when they approach a program, they basically look at the statistics of the problem in a country. And if you look at the child mortality statistics, preterm birth tops it all. So we were told that, you need to look at this program, this problem more comprehensively, and what better way to, just have an interinstitutional, interdisciplinary. I think it was first such program of this magnitude for our department. And there was a significant investment which was made by the government for laying down the foundation of Garbhini, where I think most of you would know that Garbhini is a program where we enrolled about 8,000 pregnant women very early in their pregnancy. And I think it is one platform that has built a biorepository of very well characterized clinical phenotypes with, I think today about 1 million biospecimen. 2 million. Okay, the number keeps on increasing. The last I heard it was 1 million. So, and about 600,000 serial ultrasound images. And I think there's biospecimen comprised of maternal plasma, sera, saliva, feces, high vaginal swabs, urine, cord blood, so on and so forth. And there, the ultrasound images, they are on fetal morphology, biometry, blood flow of uterus. And we feel that this is probably the global first repository of this magnitude. So the comprehensiveness of Garbhini, that it attracted multiple global collaborations, and of them, MOMI is the most prominent one, where they are going to analyze the various biospecimen along with other similar cohorts, if I'm right, Dr. Shinjini. And then Orchestra, and of course, the program for which we all have gathered, the Calopus, right? it is indeed fulfilling and exciting, to be a part of these deliberations and looking at, how AI can change the way large data sets are handled. Personally, it has been a very, very enriching experience, very stimulating. It has given us a better understanding of how AI can actually be of so much use into the healthcare. And Calopus, which is, I think the expansion is computer-assisted, low-cost point of care ultrasound, is what our country needs. And we are glad that a platform like Garbhini, has been a stepping stone for this program to come up. And this is what, a country like ours need. We need more such devices for the point of care settings. And we do hope that, it gets validated and it actually goes there where for which it is meant. That's what is the funders look out. We look out for things which can go out there for the masses, right? So I think I'll take this opportunity to just very briefly also state that, there are several other AI-based healthcare initiatives that the department has taken, and that is across disciplines like all health disciplines like diagnostics for cancer, vaccine delivery systems, prediction of diabetic retinopathy, osteoporosis, and many other such problems. And of course, most of these are in the research stage and just the beginning, but it just shows DBT's commitment to utilize artificial intelligence comprehensively. And I think I would close by just making a mention of two major programs on AI. One is on imaging biobank for cancer, which is endeavoring to develop AI tools for advanced research in cancer, basically for head and neck cancer and lung cancer. Radiology and pathology images are there, which are linked to their clinical information. And these would drive the AI-based algorithms and application development for these two types of cancer. The other major program in AI that the department is supporting is called MANAV, which is the Human Atlas Initiative for the construction of world's most comprehensive human atlas by assimilating all the known macro and micro level information from scientific literature and public databases. So this is just a very brief about these two programs. Anybody needing some more details on it can always reach across to us and we will supply them with more such things. So I would just sum up here and finally just close it by saying congratulations to this team for a very wonderful work and successful execution. And our best wishes, and DBT is there with you all in all such endeavors, and we look forward to more such future international collaborations. Thank you very much.
I think we'll allow one question. Is there anyone amongst our younger colleagues who want to ask DBT? Okay, this time we'll have to let you ask. Yeah, please go ahead.
Actually, I'm a startup founder from IIT Madras Incubation Cell. I wanted to ask this to the industry person also in the morning session, but also to the funder DBT here, because I was a DBT BIREC Sparsh fellow previously. Now we see many startups growing up and this Make in India products coming up, and also global companies like GE and Philips also doing innovations, and new startups are also doing similar things. So where do you think this is going? Like, are we competitors or are we collaborators, or how are we going to reach to the community, whether they will be threatened by startups, the industries, or the funding partners? How do you see startups versus global companies? I'm just confused and I want a clarity on it.
Startup Expo on the 9th and 10th, which PM inaugurated. You were not there. So, I would answer, I'm actually not the right person to be answering this question, but of course, Make in India supports the startups, and whatever is cost competitive and whatever is cost competitive and whatever can go out there to the masses. That's all I can say. You can answer it better than I can.
No, not better than, but I'll just add what you said. See, as far as the new people are concerned, like the young brigade, you are just coming. I'm audible. Okay. I don't think there's a competition, right? It's a healthy to take it forward as a team, right? If you are developing something and there are different branches or there are different divisions in each organization, which really welcomes such kind of a talent, right? It's not that we are competing with you or you're going to compete with us. See, today, if there are people who are working for quality AI tool towards the healthcare, every organization will love to work along with them. After all, there are lots of people who are working in the industry also and outside the industry also. The only thing is that how they communicate with each other and team up, right, for a noble cause. I was discussing just now in the lunch session with one of your youth. I said we have to see the goal, right? If the goal is noble, end of the day we are saving a life, whether it's through you or through us. So we have to team up and we have to communicate. And I really want to thank the organizing committee that they have invited lots of different people into this particular platform. The only thing is that how more we communicate each other and build our team rather than come.
Okay,
Thanks.
thank you. We'll actually move on. I'm so sorry for rushing through these because lots of people have to leave for their flights. And we do want to go till the end of the scientific session and then break up for coffee, if that's okay with you, because we have one more session, one more speaker from the funding organization, something that again, you people have been looking forward to. These are the career fellowship programs that India Alliance runs with as part of the DBT Welcome collaboration. And Dr. Soumya Kanti Ghosh, welcome. And also like take this opportunity to thank India Alliance for supporting a component of this conference. Over to you. He's a grants advisor and himself a scientist, a PhD in infection immunobiology and computational biology, right? Welcome, Soumya.
Thank you, Professor Bhatnagar, for giving me the opportunity to talk about the funding opportunities at India Alliance. So I'm Soumya Kanti Ghosh. I'm a grant advisor at DBT Welcome Trust India Alliance. So the sphere of action, the reason why India Alliance was established at that time to support education, training and research in science and technology in order to build capacity in biomedical and health research by strengthening and later on lead to the strengthening of the research ecosystem in India. And we tried to add some extra elements into it by fostering interdisciplinary and international collaborations. And we are also of the opinion that science should be accessible to everyone. So India Alliance is a public charity which invests in transformative ideas which are solely directed towards biomedical and health research. The main two funders of India Alliance are Department of Biotechnology, Government of India, and Wellcome Trust, United Kingdom. India Alliance was started in the year of 2008 with its flagship programs of fellowship, which was completely focusing on biomedical research. And there were three fellowships, early, intermediate, and senior fellowships. And later on, based on the success of the fellowships in biomedical research, the organization started the same kind of fellowships for clinical and public health, but with some extra benefits. And then once the fellowships were running well, and then we moved into the grants. And currently we are in the second phase of funding from DBT and Wellcome Trust. So here you can see our funding has spread around 47 cities, touching 133 organizations through more than 530 awards. So our initial focus was in the fellowships and grants, and that is to build research capacity in India, as I've already mentioned, and catalyze international competitive research in India also. So so the research areas where India Alliance focuses basically are on basic medical research, clinical research, and public health research. So these are the remits for applications in the fellowships. So we for the researchers to launch the post PhD career of researchers, we have early career fellowships. For those researchers who have good, excellent track record and want to have an experience as an independent researcher, for them it is intermediate fellowships. And for those researchers who are established and have made the mark in their research area and now want to become the leader in their respective field in the research community in India, for them we have senior research fellowship. Now, the objective behind the India Alliance Fellowship Program were to implement globally recognized grant funding model, develop effective mechanisms so that we can nurture outstanding biomedical scientists, as well as devise new mechanisms through which we can fund researchers and physicians who are interested in clinical and public health research. Now, there are certain salient features which are there in the fellowship and which makes it a coveted one. First is our entire fellowship focuses completely on the holistic development of a lead investigator. We do take cognizance of non-research career breaks. That means while calculating the eligibility of the prospective applicant, we always consider the non-research career breaks, but it should come along with the proper justification. Then there is no restriction over age or nationality. Person of any age and from any nationality can apply for the fellowships, provided they will have to complete the entire 5-year project within India in a host institute in India. We encourage to pursue interdisciplinary research. That is also one of the bigger goal we have. And we always try to emphasize over the fact that it is better to have national as well as international collaborations, and you will get to know how it is possible. And our fundings are very flexible and as well as generous. So the fellowships, as I said, they basically concentrate on two more research areas. One is basic biomedical schemes, another is clinical and public health. So there's not much of a difference between both, but there are certain features which are different, and that's the reason why I'm presenting you the fellowship provisions for both the schemes in a separate way. So for early career, the only thing is for early career, you need a fellowship supervisor. You cannot be just an independent researcher. You need guidance from a supervisor who is an already established faculty. For intermediate and senior, there is no such provision. The duration for all three fellowships are 5 years. For early career, it is from last year of your highest degree till 4 years of your active research experience is the eligibility criteria. Once you cross 4 years of active research experience post PhD, uh, you cannot apply for early career. For intermediate, it has to be a minimum of 4 years of experience to 15 years of active research experience post PhD, and same applies for senior. If you look at the budget cap, it is 1.7 crores for early career fellowship, the total overall budget cap. For intermediate, it is 3.6, and for senior, it is 4.5. Major equipments are allowed. A fellow who is in an intermediate and senior a senior fellow can apply for equipment which is even more than 50 lakhs, with provided justification has to be provided for that. But for early career, the cap is 10 lakhs. So the equipments within the 10 lakh amount has to be requested. Now for support staff, for intermediate and senior fellowship, for intermediate, prospective applicant can request for 2 support staffs, which can include postdocs. For senior, it is 4, the cap is 4, and that also can include postdocs. For early career fellows, you can ask for one single technical support staff, not JRF, I mean, not PhD student, but it has to be from the second year of your fellowship. As I said that we appreciate if our applicant are focusing on international collaborations, and in order to do that, we have provision for work outside host institute, where early career fellow can work for 24 months outside the host institute abroad, and also within India, it's up to them. An intermediate can avail it for 12 months. For senior, no such provision is there. And by during that period, a subsistence amount of $3,000 per month will be provided to them. And it will also include 1.5 consolidated amount of 1,50,000 rupees as travel expenses. Other than that, we have travel allowances, contingency, and there is a huge amount which can be requested for materials and consumables, for equipments, access charges, then miscellaneous charges and animal purchase and maintenance. For clinical and public health, mostly the things are features are similar, but one of the difference is the eligibility. Eligibility is similar for early as well as intermediate and senior fellowship. That is, the prospective applicant can be from the last year of the highest degree to 15 years experience. Then duration is 5 years for all the fellowships. Budget cap is a little bit higher than compared to the basic scientist one, and rest all features are similar. In the case of support staff, we do have a cap of support staff for all the 3 fellowships, but if provided proper justification, we are flexible over the number of support staff one can request for. Now the application cycle of the entire fellowship takes nearly around of 10 months, which includes preliminary application, where the CV and abstract project proposal will be looked into, and then there will be a screening process where applications will be invited for full application, and then the application will undergo international peer review, then selection committee shortlisting, and if selected for interview, then they will be called for interview and henceforward fellowship award. But there are 2 things which have to be kept in mind, that if your application gets rejected in the shortlisting stage, you won't be able to apply for the same fellowship or any fellowship junior to that. If your application is rejected in the shortlisting stage of intermediate fellow, you are not allowed to apply for intermediate fellow again, nor in the ECF. You can only apply for the senior fellowship. And before you get your fellowship award, if you have any other fellowship at that time, you will have to give an undertaking that you will relinquish the other fellowship in order to avail this one. Now, the deadlines: early career fellowship for biomedical research, the application opens once in a year. Senior and intermediate fellowship applications opens twice in a year. For early career, intermediate and senior fellowship for clinical and public health research opens only once in a year. Now moving on to the grants. So in 2019, India Alliance started with 2 kind of grants. One of the grant is majorly focusing, which majorly focuses on interdisciplinary, interinstitutional kind of study. which can involve institutions within India or abroad, India and abroad. And the second one is completely focusing on the clinical researcher, that is Clinical and Public Health Research Center. So Team Science Grant was established to foster interdisciplinary collaborative research, but it has to address one of the important health related challenges. Now, who can apply? So the entire Team Science Grant team should have minimum of 3 participants. One has to be the lead PI and 2 other co-PIs, but not all the PIs can be from one institute. It has to be one and at least minimum of 2 institute participation has to be there. The lead PI should have at least 5 years of active research experience. The co-PIs can have experience of around 3 years, active research experience of 3 years. Then the funding for Team Science Grant is for 10 crores, and it also includes, it includes 10% of overhead which institution gets. It's again 5 years project, and the funds can be requested for hiring staff, purchasing equipment, access charges, and strengthening research management within the organization. Now, clinical research centers are basically institution focused. I mean, the team science grant was all about the individual, but clinical research center, it is the institution which applies for the funding. So that is actually created to establish research-oriented virtual centers that aims to improve clinical and public health research ecosystem in India. The funding amount is same, that is 10 crores, and it's for 5 years. And the funds can be requested for hiring new clinical and public health researchers, purchasing equipments, maintaining clinical and population cohort. One of the very interesting element into it is the training of early career clinicians. So clinical research training program is basically embedded within the CRC program, where the aim is to develop physician scientists to strengthen their research capacity. So basically promoting them to move into research along with their clinical jobs. So here, under this, 12 fellows can be, 12 people or individuals can be awarded fellowships, and that would be for around 3 to 4 years. And the total fellowship amount each fellow will be getting, that is around 50 lakhs. So till now, our fellows have touched around these all research areas. You can see around 9% of our fellows are working in clinical research and clinical practices, and 1% in health service research. When I talk about health service research, it also includes one of the fellow who works on tobacco. So to reduce the tobacco consumption, policy-driven studies. So we have fellows who have creating framework of policies where government of India, they are, in work with the government of India in this case. So now that now that I am in the conference where we are talking about artificial intelligence and research, so we have few of our fellows who have been working using artificial intelligence in their research. The first, you all know, Dr. Desi Raju. So he aims to develop algorithm to predict preterm birth during mid-semester of pregnancy using ultrasonography images and convolutional neural network. He has completed his fellowship. Dr. Tavpritesh Sethi, he's from AIMS, New Delhi. His work was focusing on early detection of sepsis in children and newborns, and he was trying to utilize ICU data, for example, data points from pulse, heart rate, respirations, blood count, and all, in order to develop a mechanism where he can do the early detection of sepsis. Then we have Dr. Hannah Mary Thomas from CMC Vellore. She aims to use quantitative imaging based radiomic signature of biomarkers to develop prediction models. so that by machine learning in order to support her clinical decision making for head and neck cancer. Now, gradually, as the fellowship and the number of fellowships increased, we started giving more number of awards. Publication rate also increased, and as I have already told, that we do emphasize that science should be available to more people. So, so you can see there are few articles which are published which are not yet free to read because they are in the embargo period, or the process of open access is under process. Rest all we actually appreciate our fellows if they can provide open access charges and then get the paper to be read by everybody. So this is something which is, I will just take 1 minute to complete, sorry. So this is, I think this is, yeah, kind of last slide. So this is one of the idea which came along. It was very new within India Alliance that in 2018 we had a pilot project where we realized that there is a dearth of understanding of project management within the institutions, and how to manage projects and how to get more benefits, reap more benefits out of it. So for that, we started with India Research Management Initiative, which has 3 components. One is Research Management Travel Grant, where we provide fund to those applicants who are interested to go visit, attend different conferences, workshops on research management. Then we have Research Management Grants, where the institute gets a grant amount where so that they can develop the platforms, they can utilize it for the, like, they already have a basic management setup done, but to enhance or advance on it, uh, we provide them a grant. Then for example, institutes which have very new member who have joined as a grants manager in the institute, and in order to train them and in order to enable them to be sufficient enough to carry forward the grants management system within the institute to different departments, we provide research management fellowships. So we have our podcast, we have our videos, you can see in the YouTube, where our fellows talk about their science, and so that the science, what are their ideas, can we reach out to the normal people who are not in the scientific uh, uh, area. Yeah, so if anybody have any question, they can ask here, of course, but if you have more questions, then you can certainly write an email to info@indiaalliance.org, and we'll be very much happy to respond to you within 3 to 5 business days. Thank you.
Thank you. That was really nice, very exhaustive, and I think most of the information was there. We'll allow just one question if there is any. Otherwise, we'll go on to the. I think Soumya, it was very complete. So if there's anything, I'm sure people will reach out to you. But we've certainly benefited from the India Alliance program. So it was a nice combination of Garbhini getting funding from DBT and then getting Kanti and Ram and all and Kanti coming and starting AI and Garbhini. So it's been useful. Thank you so much. And thank you for supporting this workshop.